Okay, the geniuses will see us now.
I'm a pro.
He's very unprofessional.
Very unprofessional.
These are our newly arrived surgeons, Doctors Trowbridge and Greenbaum.
Doctor?
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 We're not doctors.
Are you sure they can handle this?
Oh, we can handle it. We're professionals.
You'll forgive us if we're not instilled with confidence.
Potentially unprofessional pieces of content.
Okay.
We're starting in the middle.
What's up?
All right, your sister-in-law.
We already started, but she was listening to one of the podcasts, and she listened to the dating one, and my brother just introduced it to her as, "Hey, listen to this new podcast, of these two medical students," and so she got into it, and then she heard my laugh, and she's like, "Oh fuck." But why I bring it up is she was like, "Oh, I really liked it." So if every one of our podcasts that talks about girls and dating it, I guess that maybe it's not the worst thing. I don't know.
It's supposed to be like a little bit helpful, but we're just like, fuck it.
Yeah.
I don't know what we want to talk about. Who cares about med school?
The dating one was a special podcast, quote unquote, but it's been like every episode.
The med school ones are the special episodes.
Yeah.
I told a bunch of my friends about it before like we released it and everything when we were like getting it set up. And since then, I haven't mentioned. So I gotta tell them to go listen. Which episode? Should I tell them the dating one?
Well, here's the thing. I didn't tell them to listen to any specific one. Fuck. What time is it?
No, it doesn't matter.
No, we have to do that.
Your brother?
Yeah, what time is it?
Fuck. 1:18. It's probably a new record. We got it so fast.
Yeah, that was pretty fast. So I didn't tell him to listen to it. Or any specific episode, and I didn't tell my sister-in-law to listen to any specific episode. So he listened to the newest one, the one that we just came out with, and then she listened to the dating one, which is interesting because she specifically picked that one. And then my brother was just like, "All right, the newest one."
I'm like, do I want my friends to listen to it? It's just embarrassing shit. But
that's the best part, bro.
I also kind of don't care. I'm pretty sure they all know this shit already anyway.
Right, people either already know it or you should have revealed that kind of stuff anyway if they're like willing to listen to the podcast. Like, yeah,
but like I don't
be honest enough that they would know those kinds of things if they asked. Yeah,
I don't talk to them enough anyway, so I'm like, this way at least you can like keep up with me, and then like
right, and that's kind of nice too because then like people can friends back home if they listen to it, they're like, oh shit.
Yeah. Oh, so those were his
views
on the homeless people.
No. Maybe I won't.
I
hang out
don't
with
like him anymore.
Yeah.
What a fucking dick. I just, I gotta make sure it doesn't get back to my mom. That's the only thing. My mom would fucking disown me, bro.
No, you gotta reveal everything.
My mom wouldn't understand half of it because her English isn't that good, and she'd be like, "What did you say?"
Well, perfect.
So anyway, what story? Oh, Trevor fucking. I heard him laughing outside as he was coming into the apartment, and I was like, "What happened?" And he's like, "Oh, bro, you wouldn't believe what just happened, but I'll tell you about it on the podcast."
Okay, yeah.
I've been waiting.
So, okay, I'll tell you that one, and then I'll tell you other ones too. I've been trying to. I'm like, all right, if I see Pretty Girl from now on, I'm just gonna go say hi to him and like, just talk to him.
It's hot girl summer, man.
It's a hot girl summer.
It's time to do it.
Yep. I don't know how I feel about hot girl summer. It's a little bit too much, but
you're scared now.
Yeah, I'm like worried. Like,
yeah, I need.
You're just like having sex with everything. Jesus.
I gotta hide my cock.
No, that's not it. But so there was this cute girl walking away from the gym. We live right above a gym, and I'm like, oh shit, I gotta go talk to her. So I speed up next to her.
And I sprint.
Yeah. Well, anyone watching is like, what the fuck?
Out of breath when you get to her.
And I tap her elbow. I'm like next to her. I'm like, I just introduce myself.
Wait.
Like,
you said that multiple times now. You tap their elbows like legit.
I literally tapped her elbow.
Why their elbow? Why not like their shoulder or something?
That'd be fine too, I guess.
Okay.
I don't know. For some reason, I tapped their elbow.
So you want to knock the shit out of their hands?
Yeah. So I knock the shit, whatever's in their hands, I knock it to the floor.
Her phone screen
and I go, oh, sorry.
Alright, continue.
Do you want a date now?
And let me get your number so I can buy you a new phone.
Yeah, sorry I broke your new iPhone 12.
Oh my god.
So then I'm like, hey, I'm Tucker. I think you're really cute. I was just like being honest with her, and then I just wasn't that smooth because I hadn't talked to anyone yet that day, at all. You're just not exactly warmed up. But anyway, I like talking to her. Long story short, I'm like, well, let's hang out sometime. She's like, okay, sounds good. She's like very receptive. And then I don't have my phone on me. So she pulls out her phone and I type my number in it. And then I give it a call so that I have it and I'll text her later, right? But I think I hung up too quickly. So it didn't go through.
What?
But I didn't know that yet. So I'm like, okay, bye. Give her a hug. I'm like, dang, this looks really good. Like, she was really receptive, and I said the dumbest things the whole time. And I go back home. I'm pretty excited. I'm stoked. I look at my phone. No call. I'm like, no! I'm like yelling at myself. I'm like, you fucking idiot.
Why didn't you have your phone on you, bro? You're outside.
It's not even a problem. It shouldn't be a problem.
I know.
It should have worked. Man. So I'm like, fuck. Well, what are my options now? It either didn't go through because I put the wrong number in, or I think it didn't go through because I hung up too quick. Mm-hmm. So she'll either look at the number and text me, which is a short chance, I think, or I fucking go find her. And now I'm a serial killer.
What's her name? What's her name? Do you know? You don't know.
I don't know. Oh, it's Liz. It's Liz.
Liz?
Mm-hmm.
Okay, so Elizabeth. What's her last name?
I don't know.
Ah, fuck, bro.
Why would you? Why would I reveal that?
At least now we know that she goes to like the gym downstairs. All you have to do is go inside and be like, hey, is there anyone named Elizabeth that's a member here? Go through their fucking list, find her, get her phone number, get her address,
and just be a total crazy person.
And just like, be like,
and
oh, hey, Liz.
Here's the best part of the whole story. I did go try to find her.
How did you do that?
Because here's the thing. She's like, oh, I live far, it's a long walk back home. And I'm like, okay, that was one of the last things she said. So I had just gotten back to the apartment. It was like a 30-second walk. We were right by here. So I got back. I'm like, if I go right now, I could find her. Because she was going along one of the main roads. I'm like, she probably didn't deviate.
Oh my god.
So I get on my bike and I just bike, not super hard, I'm biking though, and I see her on the street. I'm like, alright, this is gonna be weird, but what's up, Liz? And I'm like, you probably think I'm a crazy person, but it didn't go through. She's like, oh, okay. And then she gave me her number, and then I high-fived her and biked away.
And then she ghosted you?
Yeah, and then she's like, this insane person cornered me today. No, she's been texting. It's been fine. I mean, but it doesn't give me good hopes because she's like, oh yeah, I'll be free next week. It's like, what?
Shit, yeah.
That's never a good sign.
Oh, I'm working out every single day for 6 hours, so I can't hang out with you.
Yeah, right.
Even though like you live right upstairs.
Those gluteus maximi just pumping.
Yeah, but you did the right thing, man. In the gym, she had all the power, like we discussed in a previous podcast.
I don't think we discussed that on the podcast. Oh, did we?
Yeah, I think we did. As soon as she walks out of it, you're equal. And then you go in and you're like, hey.
I mean, you're not Trevor. Wrong, but yeah.
We already talked about that one.
I agree.
But that's awesome, dude.
Yeah, so anyway, yeah, I'm just glad that I did it, that I went out there and did it. Even though it could have gone better.
Yeah, should I tell the follow of like the nurse?
Sure, why not? We're already on this fucking shit.
This is like at least related a little bit because we're in the ER doing this. So all the way back to that girl you asked out. She was like 1-to-1 or whatever.
Yeah,
she's watching a patient.
Girl, like purple scrubs. I asked her out during rounds.
And she was like, you were like, do you have a boyfriend? She was like, I have lots or some shit like that.
Yeah,
right?
and I was like, do you want another one?
Yeah. So I'll tell you the whole story because I think I texted you part of it. So she was like working with one of the old ass nurses, and she's like one of the ones that I go to like get lines and stuff. So I went to her and I was like, hey, how are you doing? Like, if you have any lines, let me know. She's like, oh, I have one. It's an older lady. She's like, do you want to go? And she's looking at, this other trainee nurse. It's like extern nurse or something. And she's like, oh, she's a student too, so you guys can do it together. I was like, oh, okay, cool, whatever. But I was like, fuck, I want to do this myself, but it's fine. I guess I can like teach. So we're going and like we're trying to do it, but like we're getting all the shit. And I was like, damn, like she sounds familiar. And then like we're doing the stuff and I had to go like do see a patient or something, and I like had to deviate. So I was like, oh, like you can do this yourself, and she's like, well, I've only done like 3, so I'm not gonna be able to do it. And I was like, okay, whatever. Like I gotta go do a patient. So I see a patient, and I get back. She's like, oh, you didn't. I was like, did you do the line? She's like, no, I didn't. I couldn't, do it by myself. And I was like, okay, let's go do it. So we're getting the shit again, and she's talking, and I'm like, you sound really fucking familiar. And I was like,
is that what you said to her?
No, that's what I was thinking. But I was like, do you know a guy named Trevor? And she's like, I'm mad at him. And I was like, what? And she's like, how do you know that I know Trevor? And I was like, well, we were studying together, and he got a FaceTime, and you sound like her, and he turned like the phone towards the screen, and I like caught a glimpse of the face. So I was like, you look kind of familiar, you sound like her. So I was like, I thought it was you. And she's like, yeah. And I was like, oh, and I had to go do some other shit. So we like, no, we did the line, and she was like too scared to do it. So I was like, fuck it, I'll do it myself. Mm-hmm. And she was just watching, and I got it surprisingly. It was really hard. It was 85-year-old. No,
hey.
Not to brag.
No one understands that.
First try.
It's some real shit.
So after that, it was like 2 hours later. I was doing my work, and I was like seeing patients, and I had like a couple of minutes, and I was like, so what did Trevor do? And she's like, I think he's trying to friend zone me. She's like, we went to get food or some shit like that. And sorry, I'm like vomiting almost. She's like, we want to get food, and he's like talking about all these other girls, and then it was just a really weird night, and I was like, oh. And then the rest of the night or the day, she was like being too flirty, which is like weird, and I'm like, and she brought up that like, oh, Trevor said that you got your girlfriend because of the advice he gave you, which is not true, by the way.
And also not what I said.
And I was like, oh, okay, so she knows I'm a girlfriend. But she's like being super flirty, wanting to do lines together. And I'm like, what? Just do it yourself, man. Like, I'm busy. And then like just being more playful than like you'd expect from like a complete stranger that you met like, this morning and talked to for like all of 15 minutes. Yeah, it was weird, and I was like, man, she's like, maybe she's trying to do this for Trevor or something. I don't know. It was super weird. I thought she was being like kind of manipulative.
Yeah, she's trying to do something, right?
Yeah, I don't know what she was trying to do, but she's like, oh, this guy blew me off, and I gotta win somehow. That's the only thing I can think of.
I don't know.
And then she's like trying to do something to win.
Right. I don't know. And that is essentially what happened, I guess. We just hung out, and I just didn't try to make any moves or anything for the second time, even though I made moves the first time we hung out. And so I don't know. I think I'm just gonna call it.
Oh fuck! I should have put my phone on Do Not Disturb.
Oh,
yeah,
that's okay.
Whatever. We can cut that part out if you know how.
Yeah, I will. Of course I know how.
So I don't know. She's gonna be here all week. Should I get more info out of her or no?
I don't care anymore. You can do whatever you want.
Should I hype you up and be like, oh, Trevor is like a really good guy. You should give him a second. Okay.
I mean, if you want to, but that's so unnecessary.
Or should I just like fuck with her?
Yeah, I'd say fuck with her. Okay. And just, not in a rude way, but in a whatever makes you laugh.
Not in a rude way. I'm just like thinking what would be the funniest thing I could do. But I'll find something to keep myself entertained.
Yeah.
All right. What was the next thing?
Yeah, that was pretty much that. I mean, nothing too special.
She was nice though.
Yeah, she's great. I don't want to do whatever I don't know. She's trying to like, I don't know. She's doing weird. She's playing games, and I'm just like, I don't really like this. So.
But she's young. She just graduated from like nursing school. So I'm assuming she's like 21, 22.
No. She's like 27. She's like older than us. She's like 28. Old, yeah.
Man. I thought I was.
Yeah, she's trying to do law school at first or something. I don't know. Yeah, that was pretty much that. There was, I mean, this is just funny. I mean, it might not be podcast material, but I was talking to, there was this really pretty girl who's a med student. I haven't even told you this story. And I saw her walking one day, and she was walking with a guy, like step with step, and like obviously from her home to the hospital. So I'm like, okay, probably her boyfriend. I'm like, so I'll just lay low. But then I saw her at the locker room, and she was cute and right next to me, and I was like, so I started talking to her a little, right? And then for the next like weeks, she was just giving me the most flirty vibes in the world. Like, couldn't be misconstrued. She was looking at me just with like full contact while walking by me, and kept eye contact while walking by me and stuff, like, and not just like looking, like, you know, it's that extra something.
Drooling,
Yeah. And so I'm like, what's happening? Like, I'm like, well, all right, I'll give it a shot, and then this can just stop, or it'll work, you know? So, whatever, we start talking one time. She's, like, standing in front of me waiting for the elevator, and I was just sitting there drinking coffee before it. So I'm like, I was just talking to her, and then I was like, and she's being, like, flirty again. I'm just like, so, hey, like, let's grab a drink sometime. And she's like, oh, no, thanks. I have a boyfriend. I'm like, oh, okay, you know, and then just keep talking, and then she leaves. And then she just doesn't look at me anymore. But it's like, you know, I was like, why not?
Yeah.
I don't know, that was it, but it was like, I don't know. I don't know why she was being so flirty then.
So weird.
I don't know if it was just for attention, or maybe to, like, put me in her back pocket for later, or if she doesn't, you know, I don't get it.
Yeah, I don't get the shit that girls do either.
I mean, I think it might have just been for, like, attention. I don't know.
Yeah, girls love attention, man. Here's the thing: why do you dress up to go out if you don't want people looking at you? You know, girls say that they do for themselves. I'm sure that's like part of it, but
yeah, I don't know about that, man. It's like, why? I don't know. There's a lot of evidence that that's not the case.
Like, here's the thing: the biggest evidence I have. All right,
okay,
I would be okay going outside like this. So.
He's wearing complete garbage, by the
way. Literally, my sweat stains have burned into the fucking shirt, bro.
The visual for the pod
so
would
bad.
Be, all gray sweatshirts, sweatpants, because that's what he's wearing.
Yeah.
So anyway.
And sometimes I'd like go get food with my sister. She'd be like, "Oh, let's go get food." And I'm like, "Okay." And I'd be wearing stuff like this, and I would be fine going into the restaurant or whatever. But she wouldn't even like leave the car for under any circumstance. You know, if she was wearing something like I would be wearing.
Well, that's different. I think like lots of girls will go do something in public if they're not feeling it though, and wear like sweatpants, sweatshirt, or something. Not all of them, but like a decent portion.
Yeah.
So I don't know about that.
But my sister wouldn't like leave the house for like anything unless she was like
that's
dressed
some of the,
and had
the
makeup
girls.
on.
But then the question is, okay, you have a boyfriend, or maybe you don't, but you're going out that night. And you're dressing up a ton. You know, you got the heels, even though it hurts. It's like, fuck.
Yeah.
You know, explain that to me if you're not at least going for like attention or something, or trying, or you know, or when they say, oh, I'm not trying to do anything with a guy tonight, or like get any numbers, or like do anything like that. You know, I'm dressing up for myself, and it's like, are you though? Are you?
But here's the thing, like I get it, and I think girls, I get part of it. I don't get all of it, but I think. Girls like dressing up for shit, and for most people, like how many times like do you go out for like, you know, a gala or some shit, or like some high end like dinner or something?
Yeah, so you may as well
like if you go to the club, you can dress up as nice as you want, and it's like fine, and it's appropriate for that situation. So you get to like dress up, look nice.
Well, and here's my thought too. All right, yeah, you might not be dressing up for guys, you may not be dressing up for whatever, but I bet you're dressing up for other girls. Like I think lots of girls dress up for other girls, and they don't want to admit it. Like, yeah, you're really wearing those like super high waisted pants that no guy really cares about for you, or you know, I don't know. It's just
some of the stuff I get because like girls like paint their nails and wear earrings, and I'm like, I don't care about that. I don't think any guy cares about that.
I mean, I like it.
You do?
Yeah.
Okay. Then. I don't know. I feel like most guys don't care about that stuff.
Mm-hmm.
Like
I mean, their attention to detail to some of those things is way overboard compared to what guys like. But like I like, you know, lots of like feminine things. Like I mean, earrings look good on lots of people, and then you know, long fingernails I think are pretty too. But
they can't be too long though.
I'm fine.
If you can't wipe your butt with them, then.
Well, I mean, utility issues and everything. I don't care about their utility. You know what I mean? Like, I just want them to be pretty.
No. All right. Tell me about your fucking peds, bro. You'd have to work with that crazy ass doc that we had to work with, and I saw him on the street, and he was like looking at me like he remembered, and I wanted to fucking hit him, bro. Like I'm not even joking. when I sent that message to the group chat that I want, like, someone tell me to assault him and I will, like, I wanted to hit him. I wanted to push him into, like, you know, the subway tunnel or something.
Jesus, man.
I hated my 5 weeks with him, and he's just not a good person, dude. He's just, like, a bad guy.
Maybe you could talk to him and resolve his issues.
Yeah, I'd be like, yo, go fuck yourself.
Well, maybe not.
The
like
week
that.
I had with you was the worst week of my life.
Was it that bad?
Yeah, it was terrible.
Jesus Christ.
He's just not. He has like a weird, like maybe small man syndrome because he was talking to us about how he like punched one of his patient ones, and how he doesn't take shit from anyone, and you know all this other bullshit.
Oh, I have to bounce back for a second. When I was talking about that pretty girl that I asked out, who's a medical student. So the funny part of the story is one of the med students who works with us. I'll tell you who after, the tall Indian guy.
Oh yeah.
He asked her out too.
He did.
Yeah, because I talked to him one day and I was like, you know, I was just like shooting the shit and like asking him about it. Do you have a girlfriend? That kind of stuff. And I'm like, oh, so do you like ask girls out or what do you do? And he's like, oh, not really lately. And then I think that kind of pushed him and he's like, you know, I'm gonna start doing that. And then he did it. And he asked her out in the elevator like a few days later, and I was just like, that's my guy.
How did he do it?
He's just like. They were in the elevator and something about he had a cough and he's just like, do you want to get coffee sometime? I don't know. I didn't have more details, but
that's hilarious.
Yeah, I was like, that's my guy. Also, that's fucking hilarious.
I hope it was smooth, but I feel like he annoys girls a lot too.
He does?
Yeah. Because when we were on like similar teams, when I was on like one team and he was on the other team, we'd be working on the same floor. And some of the girls were like getting really annoyed, but like,
well, he's the biggest troll ever.
Yeah.
Like I love it.
Yeah,
I love it.
He just like that was the thing. He was just doing too much. He just didn't know when to stop. You know, It was funny, and then he would go a mile past it, and the people would just be like, "Okay, just."
Well, that's why I think he's probably not great with girls. You said you think he's good or not?
No, I didn't say anything.
Oh, okay. I think you said something about being smooth or something.
I asked if he was smooth.
Oh, I don't think so. He's funny, but he's not like smooth.
Yeah, he's pretty funny. I'll give him that.
Yeah,
it's hilarious.
I just thought it was really funny.
That's why you gotta start off with like girls that like you can get, just to build the confidence and then move up. Right.
Well, unless he takes that like a champ, then it's dope, But most people can't do that.
Yeah.
Rejection is tough for most people. I mean, dating requires courage for sure.
Yeah.
And valor is rewarded with I don't know, beauty. The people that you want to be with.
Yeah. Dude, like, Abraham is like, we don't have to block out his name because no one knows who he is.
That's
Abraham
fine.
is like fucking lucky, dude.
He's going to be like a mascot.
A single guy in New York. And
it's not lucky.
No. Let me finish it, bro. He has the most liberal group of friends like you could ever want. They're all like models and like artistic people, and his parties are like everyone's just looking to hook up. Like,
yeah, I mean, yeah, that's good, but I think he's looking for things and he's not getting them.
what do you mean?
Like he's like he literally tells me, oh, I'm looking for someone to be with, and I can't get it. Not only that, but he's like, I don't know, he just doesn't like being around those people too. So I don't know. That's what he's kind of saying.
Mm-hmm. But he also like contradicts himself, and he's like, "Man, it's hot girl summer. These girls are just like looking to fucking jump on you wherever you got." And he's telling me about how good it felt when like he was walking home with his girl, and some of the girls started talking to him, and like they were competing for him. He's like, "Oh, it was
That's what he like is. That's what he like lives for."
Yeah, of course. Come on. He works out like fucking 13 hours a day, dude. Of course he wants people money.
I mean, it doesn't look like he works out that hard, but.
All right, tell me about your P's experience now. Leave girls out of it.
Is that possible?
No.
Okay, so...
How many of the babies did you ask out?
So there was this 3-year-old infant that was like... I'm sorry, 3-month-old. No, I mean, it's crazy. I mean, we're in the middle of New York, like Brooklyn, and it's... I don't know, like... The 14-year-old guy that comes in, and I mean, first of all, he looks like he's like 22, which is crazy, but he's 14. I mean, I felt like a little baby when I was 14.
Yeah.
But he comes in, he's got asthma, so we're like treating him for it and stuff. And then you got to ask everybody, do you smoke? Do you drink? He's like, yeah, I smoke marijuana. It's like, okay, that, you know, nothing that crazy, right? But then it's like, okay, how often? He's like, well, you know, like every day. It's like, geez, okay, well, that's a lot, you know. So how much do you think you smoke? And then he tried to like, first of all, it's Frankie who's doing this discussion, and she does not know lingo for drugs. That's for sure. She would not be the person. So he's like, you know, like a dime a day or something. And
I don't even know what that is.
I don't either, but just the way she went about trying to figure out what that meant is just the funniest shit. She's like, a dime, like the currency? He's like, no. And then it's like, well, what, you know, can you quantify it? Is there some kind of quantity that you can give me? And he's just like, well, I'll do like 2 ciphers a day. And she's just like, I don't know, you know.
What the fuck is that?
I don't know, like sitting in a circle smoking. But it's just like, but so, and then we eventually got it down to he smokes like 3 or 4 like joints a day, and it's like he's 14 and has asthma. It's like, damn, wow, you know, I don't have to be a fucking, you know, attending to figure out that you probably shouldn't be smoking weed that much. It's probably affecting your lungs a little bit. Yeah, you know. And there was another little girl who had been smoking since she was 11. It's just like, fuck, that's crazy.
Yeah. How did he even get this shit, dude? Where did he get the money? Fucking.
Well, and bro, here's the thing. When we were questioning just talking to the 14-year-old boy about smoking weed, the mom was there too, of course.
She knew?
And yeah, not only did she know, but when Frankie asked, what's a dime? The mom was like, you don't know what a dime is? Like, you fucking idiot. You're a doctor and you don't know what a fucking dime is?
Oh my god, that's so funny. I'm from a small town. That's what she should have said. So, yeah, I've noticed that too. When I was in Peds, like, there was a lot of kids coming for asthma. And they were like, the New York air just, like, sucks.
Oh, definitely.
And so they grow up with, like, all this toxic, like, air exposure, so they get that shit. And then kids these days, man, they're crazy. You know?
Fine. Just the drugs and stuff?
Like, I asked my parents.
Since you were 11?
No, dude. I started when I was 14. Like normal people. No, it's crazy. Like, I bet they get this shit from like TikTok or something, where they like.
I mean, it's also like it's New York. It's not where you're from. You know, the small town. Like,
whatever. Like,
I mean, that's huge.
Plus, they're probably not sheltered.
Their peers are like doing that shit too. It's just that's the biggest influence. You know that on young people.
I don't know how this shit gets around, bro. Cause like I didn't know about any of this stuff. I didn't know what weed was. You know, I didn't know what alcohol was, which is like surprising. But like at probably like 14, I probably didn't.
That's the thing. They're exposed to it like every day of their lives.
Yeah.
So if they didn't do any of it, it would be wild.
Yeah, you see fucking people whip their dicks out on the subway, so like, you gotta learn what it is.
Right, and yeah, they're not whipping their dicks out too, but they're like, okay, that's what people do, you know?
Yeah.
Sometimes people do that.
Man, you grow up fast in the city.
Yeah, dude. 11-year-olds look like they're fucking 20s, man. It's crazy.
And like, so I had a guy like that too. He was 25 though, and he was telling me he had asthma and he was coming in for like exacerbation, and I was like, how much do you smoke? And he's like, 5 grams a day. I was like surprised, and I was like, oh shit, you know, I broke character of like the neutral, you know, doctor. And I was like, 5 grams?
Can you teach me?
And then I was like, oh fuck, recenter. I was like, he was like, yeah. I was like, but are you sure it's 5 grams? Like 5 grams is like a lot of weed. Like how many like joints do you smoke? And he's like, maybe 6 or 7. And I was like, how big are they? And he's like, you know, showing me how like big they are. And I was like, okay, I guess you might smoke 5 grams, but like, you know, try to cut back, because like that's a shitload of fucking weed every day. Plus, how do you afford 5 fucking grams of weed a day? That's crazy. Like, yeah, kids these days, man. Even though he was like 1 year younger than me.
And then there's like another thing. You can come in, like these kids come in with cyclic vomiting syndrome from smoking weed. So you smoke.
Wait, you can get that?
Yeah.
Oh shit, I didn't know that.
So yeah, it can be secondary to smoking marijuana. And we've had a few of those. But this one girl came in, and the aunt was there too, and like trying to convince us of the story that just seemed really bogus. Like,
And so then it's weird because you're in the situation where it's like, I want to believe them, but it just doesn't seem realistic. And then you're like, okay, what's the actual story if that's not the story? And then you're like on this goose chase of like, how do I treat this person? Because I don't know what's wrong with them. And then we figured out that they smoked together, the aunt and the kid. But then she's like, okay, but I didn't smoke with them this time. It was, they were alone. So it was, I'm like, okay, so maybe they bought from a different source. And so I asked her, and she's like, yeah, they definitely did because they didn't get it from me. And it's like, okay, it could have been laced with something. Maybe she took something else we don't know about. Because she's like not answering me. And then I talked to the doctor, and the doctor's like, oh, she's like faking it. Like you can't, like she's actually like vomiting or whatever, but she's like faking not being able to talk to you because you don't just like lose conscious. You don't just like only able to respond to some things that you want to. Because she's like talking to her mom and stuff. It's like okay.
Yeah, my dad was like deals with a lot of this shit too. Being a psychiatrist, and he has a theory of like how this shit works. He says if people start smoking weed early, like in their teens, before their brain's done developing, their IQ points drop.
Apparently, yeah, I've heard that from a couple pediatricians. I haven't actually looked at like the study or anything, but that's what I've heard.
And they're like get all these like mental illnesses. Not from that, but just like, being constantly domed every fucking day. You like get something. And he says, having that amotivation syndrome, they're not able to finish like high school or not able to like, continue because their brains have been like affected by it. And yeah, that's basically like his take on like why people think that weed smokers are like these, unmotivated, like jack-offs that don't do anything. But I believe it. It makes sense to me.
Yeah, I believe it to a point for sure.
But I think like, past a certain age, like, I'm like pretty experienced in marijuana. But,
I mean, the thing is though, and you already mentioned it, like people go up fast here and there's a reason, like the shit is real in New York. Like this is not a small town from where we're from. This is some real shit. And so the stress is real, so like I understand. Like you want to like numb that shit down somehow, and I get it. That's one way, but man, maybe don't let your kids start at 11, and I don't know, but
don't smoke with your kids for sure.
Yeah,
my kids are getting sheltered just like I did.
And I see. But that's the thing is like, where do you draw the line? Like you can't completely shelter your kids. It doesn't work.
Yeah,
then they go even harder the other way.
Yeah,
they get to college or whatever. Whatever. And then they just blow up.
Yeah, that's
like the craziest, the most wild people I know are, were like, not all like Catholic or whatever, but they're like Catholic, shut down parents. They wanted to see anything, and they got to college and they're just fucking,
Yeah, that kind of happened to me too, honestly. But like my blow up was later when I was like more mature, so I didn't like.
Well, and that's fine, and I went through something like that too. I think everyone should go through like a dark side period or whatever, but like. My parents didn't shelter me, and it worked out. I mean, yeah, it doesn't work out for every kid that isn't sheltered, but when my dark side phase was not some crazy shit where I went on a rampage. I didn't like rape anybody, that shit actually happens, and I don't know.
Yeah, I just turned into like this angsty, like 18, 19, 20, 21-year-old, and I hated my parents at that time, and then. Yeah, just more open, and now I'm good. Our relationship's like good, but I'm like I think they should. I don't know what the legal age for weed is, but I think they should change it to 25. Honestly,
I didn't even know if there was a legal age. Is there?
I know in Canada it's I think it's 18 or 19. I don't know. I know when it was legal, I was already like fucking 25 or some shit. 24.
There should definitely be an age on it. I mean, and it's one pediatrician who's kind of a goof, but he brought up a good point. Like, you legalize it, it gets like the government stamp of approval. Like, it's a good thing. And yeah, I'm sure they said other things too, but a lot of people didn't hear that. They just saw it was, legalized and that their friends do it. And then it's like, well, shit, let's go, And then everyone's like, chanting, oh, it's good for pain, good for anxiety, good for this. And then like, all those things are true to some extent in the right circumstances, at the right age, but it's like, damn. And we don't have enough studies on this shit to know exactly what it does, so I don't have any, like, conclusive evidence to, like, drop on you and be like, oh, if you're under this age and you're, developing and you're smoking weed all the time, it's gonna do this. Like, I can't say that for sure. Like, I can't, but it's doing something. It's obviously doing something.
There was like a kid in my high school, and he was like, perfectly fine, and he went to this festival with a bunch of my friends, and he had like a, schizophrenic episode, and he came back and he got diagnosed with schizophrenia. And
here's the thing. Like, that's not...
Wait, that's not a rumor, because my dad was a psychiatrist who diagnosed him.
Yeah. Oh, really?
Yeah.
Oh,
and he goes
shit.
to my dad now.
I feel like it's a conflict of interest or something.
Yeah, it is. Dad shouldn't have told me, but it's fine.
Oh, okay.
I don't know him anymore. I don't talk to him.
Okay. Well, now it's on a podcast.
Continue.
That 12 people are going to listen to.
Yeah. No one knows who I am, man. Identities.
We've actually been getting decent views. It's still growing.
Nice.
What was I going to mention?
Something about getting diagnosed. I was saying how...
Oh, yeah, the schizophrenia thing. So, I mean, here's the thing. And there's a lot of arguments, like, against whatever you just said, because it's like, but other things can trigger schizophrenia in someone, too, not just, like, weed or something. Mm-hmm. Like, for instance, like, immigrants are 10 times more likely to experience schizophrenia than someone who isn't.
Damn,
but...
man. We need to close the borders.
Yeah, and save them. We're doing it for them. Put those children in cages because we're helping them.
We need something back.
We need to keep their schizophrenia down. But we're not saying don't immigrate. But it's just happened to be a trigger. Like, they were predisposed to it, and then that triggered it. So I don't know if that's come on.
But it's still crazy, man. So like, my point was like, we can do stuff that like we don't understand. Like, I don't know if that's ever happened in someone who's like older. But this guy was like 17 at the time, and who knows how much he did. Mm-hmm. It was like a festival. Who knows?
I mean, it definitely affects you. Even if you're an adult and you smoke all the time, there's obvious changes. Like and it's not just cultural. Like, just because you're with like more of a weed smoking crowd, I know that changes you somewhat. You're like your personality and stuff, but I think the weed's also changing you. Like it has to be.
Yeah.
It just,
I still have a goal of trying all the hallucinogenic, non-addictive drugs that I can. So I'm down marijuana and DMT.
Congrats.
And now I still got to go through, I think, PCP's non-addictive.
You're gonna do PCP?
Well,
Jesus.
Well, not anytime soon, obviously.
I don't know that much. I know enough about PCP, like its side effects and stuff, but or like what it can do, but I don't know.
I don't think it's addictive.
It seems insane.
But shrooms. So one of our friends from SGU recently went on like a shroom vacation in California. You can, excuse me. You can like rent a like trailer, and it's like in Joshua Tree. You know where that is?
No.
It's some fucking like place where stoners go or some shit. And you can basically go there, live in this trailer. You can have a bunch of shrooms, and then like people come and like bring you food.
Who is it? Can you whisper it to me? Oh, okay.
It was for his birthday. Yeah. That sounds pretty cool though.
Who got him this gift?
His girlfriend did.
Oh, what a lady.
Yeah, she set it up for them. Like, something like that sounds pretty cool.
Mm-hmm.
And I want to go to Joshua Tree as well, because like it's known for like all these drugs, and I'm like, I'm down to try something.
Yeah, I guess it's just like mostly like the chronic use of stuff that can fuck you up or should really change you in a way that you wouldn't want. I guess I don't know. Or maybe some people want some of that. But
what do you think about Burning Man?
I don't know a ton about it. I know that it's like
have you seen videos on it, right?
Yeah, I mean, it seems like a cool festival. From what I've kind of heard from my brother, who's very, very into those types of festivals, he's like, it's kind of just, I mean, whatever it started as, it's completely morphed into more of like a, it's like, it's like the most popular pop artist. That's not someone you like, you love the origin of it. You love like what it sounds like and stuff. It's the most popular now because it's the most popular. It's not the most popular because of like whatever you like pop music for. You know what I mean? Like,
but it's not a concert, is it?
No, it's like a whatever, like a festival where you do drugs pretty much, and there's like Yeah,
Like,
you
have
know, they'll like
costumes.
dress up, and yeah, obviously we don't know a lot about it. Anyone who's-
No, I saw a video on it.
I saw a video on it one time.
This guy was like, you know, you can go and there's tents where people are just having orgies. It's all about love. you
Yeah,
know,
right.
and fucking acceptance and, you know, blah, blah, blah. I don't know what the hell.
And
he's
he
talking
said,
about.
and he agreed, like that. Yeah, that's what it's all about and stuff too. But he's like, it's morphed to a point where it's like everyone tries to go to it now, and it's like this. You know, maybe he's being hipstery about it, but I mean, he makes it sound like it's not all it's cracked up to be at this point, and that all the other festivals, like whether they're music festivals or festivals similar to that, they have the same essence, but you know, don't cost a bunch of money and aren't tickets that are impossible to get. You know what I mean? Like,
I hate how everything's like so fucking busy now. Like, you can't get tickets to anything. Like Coachella like sells out in like 2 seconds.
yeah,
It's kind of annoying that like anything that's like, you know, popular you can't go to anymore.
I don't know. I mean, I don't really care.
I don't for the most part, but there's some things that like you do want to go to. Like there's, for example, there's like this place in New York in Manhattan. It's like called Little Island. Someone made an island in the river, and there's like a path that you can take to get on it. But they have like time slots, and it's like always sold out. It's free, but like you have to book like, you know, a long time in advance just to like be able to get there. Just stuff like that, dude. I don't know. I don't want everything to be super busy.
Like, I get that annoys you, but I don't know. It's like, oh, poor guy.
Poor
Like,
Ken.
yeah.
My name is Ken.
Yeah, I don't know.
I don't know. You got more topics?
Yeah. What time? How much we got?
42.
Oh, okay. Yeah, an hour is the sweet spot, by the way.
Okay.
It's like perfect. Other Pete's things. I mean, one of the dopest things, I told you this, but like, parent comes in with this, you know, like 2-year-old, baby's crying, you know, can't lift their arm, like it's terrifying, right? And the mom doesn't know what to do. The mom and the dad are the one that did it. They were like skipping with the baby, like, you know, swinging it by its arms.
Yeah.
And then, you know, they just feel something pop. The baby starts crying. They're like, oh my God, we broke our baby's arm or something. Like, this is horrible. They feel like guilty parents. They're like, we're bad. And we're just trying to play with the kid. And they, you know, they bring them in. And, you know, you're like doing your physical exam, trying to figure it out. They're obviously terrified. And then you go, oh, okay. So this is something that we call handmaidens elbow. And the elbow dislocates. It's very common in children. And all we do is we do this motion where you make your hand like a cup, and then we put their arm up to their shoulder. And that will put it back in place. And they'll, you know, then they have more concerns, blah, blah, blah. And then you just do it. The baby cries through it for like, you know, the 5 seconds, 10 seconds. And then they're like, all right, I'll be back in 5 to 10 minutes, and everything should be completely back to normal. And they're like, are you sure? And you're like, well, yeah, we'll see. And then you walk back in, and they're like, and you just give a high five with the same hand that they just had that was like dislocated and in pain, and they couldn't move.
Yeah,
and
that's exactly
they're
what
like,
happened.
oh my God, it worked! Like, that's so sick.
Yeah, that's exactly what happened one time. Like, we had a kid like that. The kid, like, I don't know if this is a test, but he did the same thing, and then he gave him a high five, and he's like, no, with the other arm, and the kid,
Because they have to move it on their own, and then it's good.
And then we were like, you know, while they're doing the discharge or whatever, we were like getting the kid to like draw in like our notebooks and shit. Yeah.
And the parents are always like, before you do the procedure, you know, they're like, don't you want to look at it more? Don't you want to like do this or that? And because you can literally go in there, like look at their elbow and stuff, and be like, oh, can they move this? Can they move that? No, okay, so we're gonna do the handmaid's elbow thing, and then fix it, and then
To keep this like sort of medicine related, I had a patient, and I was so fucking confused as to what he had. Let me tell you about his presentation.
Okay.
So it's this like 50-year-old guy.
Babesiosis. No, keep going.
He came in because he had generalized itching. He was like, I've been itching for like 8 months. It's been a long time. You know, blah blah blah. His history is not that important. He's taking like 2 drugs. Not important. Physical exam is like really contributory. He says he has like joint pain sometimes, but not really. His face is like beet red.
So he has a pruritic rash, joint pain, face is beet red.
Yeah.
Where's his rash?
Like all over his body.
Okay.
So it's
like red?
Small red spots.
Okay.
All over.
All right.
Super itchy, and he has bruising all over him.
Okay.
Like He's like black. It used to be blue and it turned black.
Jeez, all right.
He has capillary hemangiomas on his chest. On his back, he has like scars from something. I don't know what they're from. His legs have 1+ pitting edema. His arms have he has COPD. He has fingernail clubbing. He has nodules with scaling skin on the back of his elbows, on the back of his arms, and I think that's it. Yeah, what does he have?
Does he drink?
No, he doesn't drink.
Oh man.
He smokes a little bit, like a pack a day.
He's alert northeast times 3.
Yeah, all that good stuff. What does he have?
Man. At first, I wanted to say, I forget what I was gonna say.
I was very confused by seeing him. I had no idea because his chief complaint was itching.
Yeah.
So, where do you go from there? You know,
Man, I don't know. I don't know.
he had like rheumatoid or psoriatic arthritis.
Okay.
Because he had the nodules, the joint pain.
Oh sure.
And he had some other shit. Oh, he had I forgot the ulnar deviation of the fingers.
Yeah, that's
my
big.
bad.
That probably would have gave it away. But
yeah. But I was like so focused on like the itching, and stuff like this. Like I feel like you see it all the time, but you just don't put it together. Mm-hmm. You know, like it's one thing to see it in a question, but like I write this stuff down, and I'm like, okay, so what does he have? And
that's the thing, man. You have me see this stuff, and I'll have it from now on. But you give me 30 questions on it, and I still might not have that shit down. Mm-hmm. Like, I don't know.
Yeah, it was just because his like if he had chief complaint of like joint pain, then be like, oh okay, I'll be like geared towards it.
Right.
But you change one thing and then I'm like completely off the mark.
No, that's tough. I mean, that's a wide constellation of symptoms, so that's understandable.
Yeah, some of this shit throws you off. But like fucking like the ER attending says this all the time. That like everyone comes in saying their pain is 10 out of 10, which is like so true. No one has ever told me their pain is anything other than a 10.
Oh really?
Yeah.
I mean, PZR the other day, I had someone who was like, it's like a 4 or 5, and someone said there's a 6.
I don't know. Everyone comes in for the worst pain of their entire fucking life. Like they've never had anything worse. It's just surprising. Like, be more honest. Be more maybe not honest, but like be more like
reasonable.
Like calculating, I guess, because like you it's obviously not a 10.
They're worked up though, you know. I don't know.
Yeah, I don't know, man.
That's tough.
Stuff like that. I want to get better at just being able to like put stuff together. Yeah.
I've gotten better at it, and it's like the coolest shit ever. You're like, oh my god, like I'm becoming it. I'm becoming a doctor.
Yeah, but it's only been a year. That's what I tell myself, but I still need more time. Mm-hmm. Because like some attendings will go in, or like some doctors, even residents will go and be like, okay, they have this. Mm-hmm. I'm like, oh shit, yeah, you're right. It's like some easy stuff I can get. Like if they have Murphy's Law I'm like, oh okay, obviously it's like ascending cholangitis or whatever. But like other things like that, I'm like, oh, like I know what it is, like I know all about it, but
how much time do we have?
Don't know.
I got two quick Pete stories on.
48.
Oh, I thought we were at 48 before.
42.
Oh, okay. All right, so this is based on the same thing that I was saying before, and it's not Pete's, but so when someone comes with like SVT, they can also do this like magic type shit, you know, where they just like have someone move their arm, you know, a wave of the arm like they're a fucking wizard, and then they fixes them. SVT is like they have this like, you know, they have palpitations, their chest is beating super hard, you know, their heart is like going wild. And obviously that's terrifying, right? You're like, oh god, I'm dying. Like,
of course.
And it is serious. It is very serious. And so they come in, but the first thing you try to do once you realize it's SVT is it's supraventricular tachycardia. You just have them like squeeze their thumb really hard. Like that's what fixes them. Or just like hold their, like it's like a fucking like old wives' tale or something.
Yeah.
You have them hold their breath and just like contract their body like they're trying to poop or something. Yeah. And that fixes their heart. Like it's the dopest shit.
Yeah. Like some of the stuff, the way it works is so insane. Like so simple, but it works.
I know.
Like it just doesn't make sense half the time.
And once you learn this stuff, you go like, how did it take me so long to learn it in the first place? Because it's so simple. And then I feel like this is one problem I have is like I'll figure something out. realize it, like know it in my heart, and then I think to myself, oh, that's not special that I know that because it's so simple.
Yeah.
But dude, this takes us fucking so long to learn all this shit and get it down. There's so many things that could be wrong. Like, it's an art, you know. But it's easy to like be like, oh, of course I know this. It's simple, but it's just complicated.
It's funny when people back home like ask me like what my take is on their like injuries. I'm like, it's just easy stuff, man. Just take like ibuprofen, it'll be okay. Like, come on, it's nothing serious.
Yeah, I guess I feel that way sometimes too. But I don't know, and it's not just medical school. Like anything you do where you like learn some shit. I mean, you had to learn it, like, and not everyone else did too. So it's not like it just comes easy to everybody. And you just because you know something doesn't mean that everyone does. So you have something to teach people, even if it's not, something crazy like
Dude, if you went back in time, like even you'd be the most fucking like accomplished doctor on the entire planet if you went to like 200
Oh
years
yeah.
ago.
Well, of course.
There wouldn't be a better doctor in the world than you.
Right.
Like, you'd have all these tests they've never heard of. They could like get these diagnoses that they don't know what's going on.
Well, here's the thing: if you're the best at anything, or if you're even good at anything in like the world, you're like not only in the top 10%, let's say at least, of the population in the world right now, but that means you're in the top like 1% or even better ever throughout history of humankind, at something. Like that's crazy, that's something to think
Sometimes I wish I could go back to like ancient Rome and just have the fucking life, I'd be like I'd be Caesar's doctor.
Bro, you'd die of like syphilis in 3 days.
Why would I get syphilis?
Because you don't know how to make penicillin, you bitch.
I guess I'd go to see the horrors every day.
Yeah, you'd be flaunting your doctor skills and then just
I'd be like, honestly, I'd be like the emperor's doctor, because he'd be like, all right, this guy is the only one who knows what's going on. I'd make a stethoscope and shit, get it done. I could treat the things that people don't know what's going on.
Yeah, that's true. Yeah, you wouldn't need like penicillin and stuff because you could. Yeah, I mean, you'd be able to treat enough things where it's like, holy shit.
Yeah, I'd be the richest fucking dog. I start my own med school, treat all these idiots, or teach all these idiots the stuff that I know. It'd be fucking awesome.
Oh, one more thing about peds. It's crazy. Like think if you were like a 15-year-old girl, okay, and you come into the ER and you have abdominal pain, dizziness, whatever, and we do a test on you and we learn that you're pregnant, right? How do you think you feel? Like what like let's get, you're a 15-year-old girl, you've been with the guy for like 2 months, whatever, or maybe less, whatever. You would be sad, right? Or like confused,
terrified,
or at least like scared or something.
Yeah.
Bro, the girls here are stoked. What? They're so excited. What? They're grinning ear to ear, like, oh, I want to get tested for pregnancy, please.
What?
And like as if they're ordering off a menu or some shit. It's like I was so confused at first. And you learn pretty quickly that it's because one of two things. One, they're not from here, so I guess it gives you a pass somehow. I mean, at least it makes it so the kid is an American citizen, but I think it gives you a pass somehow too. And then two, which I think might even be more prominent, is they're trying to rope a guy in.
Oh.
Yeah.
And when they're 15?
Right, yeah.
Why?
I don't know.
At that age, why would you want to fucking rope a guy in?
I don't know.
What fucking 15-year-old is gonna take care of you, man? They don't have jobs. Like, why would you?
People grow up fast here, bro.
I guess, but like,
I know it's wild though. But yeah, they're fucking stoked. They're like, can I get an ultrasound? Is it a boy or a girl? They're just like ready to go, son. I'm like, damn, I didn't know shit at 15. I was an idiot.
I didn't know anything either. I didn't know how babies were made at 15.
Oof.
And then it's crazy. But like, I feel like it was gonna be damaging more than anything.
Definitely.
If you get pregnant that early, like,
it's not gonna help. I mean, just wait, a little bit more. They just don't. I don't know what it is. I haven't talked to them enough. Pregnant 15-year-olds, but
yeah.
But maybe it's because
That's where your knowledge is lacking, man. You gotta talk to more pregnant.
I gotta talk to more pregnant 15-year-olds.
Yeah.
Jesus Christ.
Gotta go to like those meetings that they have,
and then get arrested.
Yeah. No, that's actually like really sad.
Yeah, it's kind of sad.
Man, I can just see it from now. The baby grows up, the mom is like not able to take care of it. The baby's like grows up on the streets.
I mean, they're not even in high school yet, right? Or they're just starting. Like
15.
Yeah.
I was in like grade 10 when I was.
Oh
15 or
man,
something.
like, do you know how to take care of it? You know, I don't know. It's a lot.
Yeah, at that time.
I know it's gonna make things tough if you want to have like, I don't know.
Yeah.
The things you
You
want.
were almost a teen dad a while ago, a few months.
Oh yeah, no, I know, kidding, bro. And I mean, hearing her talk to me about the child like that I could have had, it was like, it was kind of crazy because she was talking about her last experience with this because she did have a kid with somebody and they didn't end up together, and she was pretty much telling me that she was like, well, you know, maybe it would make him stay, you know, that kind of thing. And I was like, so is that what you're trying to do here? Like, I didn't say it because I didn't want to pull the cat out of the bag and then she would get all defensive and be like, no. But I was like, oh my God.
Yeah.
You know, like, oof.
That's wild.
Oof.
I feel like even now, like even being like 26 in med school, I'm still a kid.
Dude,
like,
yeah, man. I mean, everyone feels, I feel like, what I've heard is everyone feels like a kid till they like die. Like, it's to some extent, you know?
I'm like not an adult yet.
Right. I have a lot to fucking learn.
Like, I get it. I take care of myself.
And what's that curve called where it's like, if you don't know enough about a subject, you feel like, oh, that's no problem, or like you have extra confidence in something like that.
Mm-hmm.
But then the more you learn, the less your confidence is in that subject. Like, you know, for instance, like our medical school knowledge, as it increased, we're like, oh my God, people know so much. I will never learn that much.
Yeah.
Like, I'm not confident in this. We're probably in that shit right now.
For some reason, like Dunning-Kruger effect comes to mind, but I don't know if that's
Maybe
right.
something like that. But then once you finally learn this stuff and become an expert, you know, it comes back up a little. But even then, like, you know, some of the most confident people as shit are people who know fucking very little about it.
That's the thing. I feel like the dumbest people talk the most. And there's one person that we know who we were doing questions together. 100% it's this. And just saying random words, man. I feel like he doesn't have like, some people don't have accurate view of like how things are.
Yeah, or like, they're you know, fooling themselves on something, which is super easy to do. We all fucking do it. I do it, you know. I try to limit it.
Yeah, but not even that, but I think some people just don't see things the way that they are.
actually are.
Yeah.
Yeah, but you can see things in a lot of different ways.
Yeah.
But yeah, I get what you're saying.
But so in cases of that, thanks, bro. Thanks for moving the mic closer. In cases like that, I don't know how. Like, I think a lot of people have that same thing where they see the world in the way that it isn't, and that makes them feel like, oh, you know, I'm really good at this thing, but you might fucking suck. Mm-hmm. Like, I know for my thing, I always do the opposite. I think I'm really shitty when I'm actually like okay. Like, in something I'm not confident, I always think I'm like terrible. So like when I'm playing soccer, and depends on who I'm playing with, if I think the other players are better, I'll think I'm shit. But I'll like still do like,
well, and that's not good either. I mean,
no,
now you're not playing as good because you think.
I still play like as well as I usually do.
I doubt it.
But I do.
Okay.
Especially over like, you know, last summer, I was playing a lot, and I was doing well enough where I was like, oh shit, so like, you know, I'm actually pretty good. But like that stuff, like I don't want, a lot of people at SU even were like, oh, I'm so fucking good at soccer, bro. And then when the soccer was going on in like the field, most of them fucking sucked.
Yeah.
Like, especially one guy, I don't remember what his name was, but he was like talking it up. He was like, man, I played soccer my whole life. I fucking broke my leg when I was like doing it, but I got back and now I'm even better than I was. He was the worst fucking guy on the team. Everyone's talking shit about him.
It's like Uncle Rico from Napoleon Dynamite. How much you want back? I can't throw this football over them mountains.
I bet he could, man. He had a good arm.
Back in the day, man. He was the fucking high school stud.
But I don't know. I feel like a lot of people have that. You know, they come to a place and they think that like, oh, or they come into a situation and they're like,
but also, I mean, also a lot of people think that they have no confidence in something and they suck, or that they could never become good at a certain thing. Like, we've all had that, and then sometimes you can. In fact, almost every time you can get good at something. You just have to put a ton of effort and time into it. But then you fool yourself into being like, yo, I could never do that. You know, I could never run a marathon, or I could never run, you know, some crazy shit. Like, but you can. You just don't want to like face yourself that you could, if you put the time and effort into it, that you could. Like everyone does that with some shit.
Yeah, but
and some
usually
people do it with everything.
I get it if it's like a challenge that's like looks so insurmountable that like you can't see yourself on the other side. But yeah, I don't know. It just
there's. I mean, the point being, there's like a lot of things that the average person needs more confidence in, and there's a lot of things that the average person needs less confidence in.
Exactly.
It's just trying to figure out which ones are which.
Mostly it's guys that think they're the hottest shit when they fucking look like shit.
I don't know, but then they could be, but then they have no confidence in other things that could make them the shit. And that's something that I try to like preach, or if I ever see that in someone, I'm like, look, like, you're obviously afraid of this, like, you're not admitting it to yourself, but if you did more of this, maybe, you know, you could be good at it, or, you know, maybe you'll get lucky or something, you know, or you'll learn along the way.
One thing that's, like, really prevalent here is catcalling for some reason.
Yeah.
Like, I don't understand the guys who think that they're smooth enough to just stand on the side of the street, catcall, and think it's gonna work. Like, I don't understand what the point of that is.
I mean, I've thought of a couple things. Like, one, maybe it works some of the time. What if it works 0.01% of the time?
Okay.
And that's the only thing that they've ever gotten to work? Why wouldn't you do that? But on top of that, at least they're like, you know, at least in their heads, they're like, I'm trying or something. Or it's like, this gives me, you know, kind of power over that girl because I'm making them, like, you know, look the other way or some shit, you know, or I don't know. I'm not sure what it is. I don't know, like, yeah, I don't know.
I don't know what the motivation is either. Like, I remember when I was back home, my friend, like, rolled down the window and was like, hey, you're beautiful, to a girl. But he gets lots of girls, so he was just fucking around.
Yeah, I do that kind of stuff, too. And I also do it to be, like, just to gut check myself, too. Like, oh, you're not going up to this girl to talk to her because you're scared. Like, you're scared, you know, and not because of the other excuses I have. And I'm like, all right, fine, I'll do it in my own head, and then I go do it.
Yeah.
I literally did that today, actually. I went to go get food at the deli, and there was this, like, girl that honestly kind of looked like my ex. And I'm like, all right, whatever. And she's, like, kept giving me looks and stuff. I'm like, fuck, all right, I'll do it. And then I started talking to her, and then she mentioned she had a boyfriend in the beginning. But one thing I've been trying to convince myself of to do is to close. Like, always be closing. ABC, baby. And I'm like, all right, well, she has a boyfriend. But anyway, I'm like, all right, well, I told myself always be closing, so I have to ask her, even though I know I'm going to get rejected right now. I'm like, what are you doing tonight? Even though she already told me that she was hanging with her boyfriend tonight. What are you doing tonight? Just fucking get rejected. And she's like, hanging out with my boyfriend. Like, I'm like, okay, bye.
Yeah, that's crazy.
Yeah.
I don't approve of that, but...
What?
You know, I don't approve of that,
oh, yeah,
but...
that's fine.
I don't know, you gotta do what you want. Just because I have a girlfriend and I don't want any guy to do that to her. Yeah. I'd be fine doing it to other people. If I had the balls to do it.
I don't know.
Who knows how girls work, man?
I'm still figuring it out.
Let's leave it on a cliffhanger. And next time we'll explain how girls work.
We'll have it figured out after that.
Next episode is in 6 years. 7 hours long.
Yeah. We have to keep our promise.
We'll come back.
All right, so this is the theory of women. It's 38,000
Should we actually
pages
do
long.
that?
No, absolutely not.
No, like have a theory of a woman podcast.
That's every fucking podcast.
Yeah, I guess.
And it's always terrible.
We'll
We
take all
never have concise thought.
It's always like, yeah, I don't know. Girls
They want attention. That's what it is. Yeah, that's what it is.
Girls just want to fuck.
I hate girls.
All right, guys.
Well,
next time
it'll be a medical podcast. I swear.